And welcome to this video. Today we're going to be discussing neck rejuvenation treatments. I'm here with the amazing Dr. Hiba Injibar from Dermasurge Clinic on Harley Street, who is going to be telling you about their unique and very renowned approach to neck rejuvenation treatments, non-surgical neck rejuvenation treatments. And Dr. Hiba, what is neck aging?
Neck aging is multifactorial. So neck aging is not just one thing or caused by one problem. It's similar to facial aging. Uh, but basically, what patients complain about, and I call them patients, they're not patients, but as a doctor, we call everyone patients. It's basically that their neck looks old and they don't like their neck. So they come to me complaining about, oh, I hate my neck. It makes me look so old. I've done so much to my face, but then my neck shows my age. It looks saggy and it looks tired, and I don't like it. So neck aging basically is an aged neck that shows signs of laxity, lines, thin skin, sometimes spots, and yeah, that's neck aging.
Obviously, there are many different treatments that can work for various types of aging of the neck. How do you typically approach a consultation, and how do you decide which treatment to essentially propose to the patient?
So basically, I would first start by examining the neck. I would ask them to tighten their jaw muscles and tighten their neck. And the reason is a lot of people do not know that we can inject Botox in the neck and in the jawline, similar as similar to injecting it in the face, and it can give amazing results. Not in everyone, because there's a muscle called the platysma that basically starts off from the collarbone, and it's a big and wide muscle, and it goes and it inserts in the lower face and in the jawline, and it even goes up to here.
Oh,
So
wow.
with aging and with time and with using the muscle, just like using the muscle on the forehead a lot with expressions causes lines, using this muscle a lot in certain people, it can tighten and it can pull everything down. It kind of pulls the jawline down and it creates horizontal necklines, neck bands, which are like long and bulky bands, and it kind of pulls everything down. So that's the first thing I would assess when examining the neck. Ask them to tighten their neck, clench their jaws, see if the neck is tight, and then I would recommend Botox. And many times they would like be surprised. Oh, can you do
Yeah.
Botox on the neck? And I'm like, yes, because it really helps. And when injecting Botox in the neck in specific areas in the platysma muscle and on the jawline and in the muscles that pull the angles of the mouth down, the results are amazing because everything kind of springs up, and the neck, when the neck muscles relax, everything is looks looser and tighter, and even the jawline is tighter.
Wow, I had no idea.
Yeah, exactly. So lots of people have no idea, and when I ask them to tighten their neck, I show them in the mirror, and they're like, "Oof, wow! I had no idea I had
Mm.
these thick bands that are pulling down." Some people don't have it, and then I do not suggest Botox. That's the first thing I would check, and then I would recommend. And the next thing is I would look at the sagging and the neck at rest. So
Mm.
without moving, without tightening the muscle. And a lot of people, with aging is multifactorial. Sun contributes to a lot of aging. 90% of our wrinkles is from excessive sun exposure, from childhood, which causes wrinkling, which causes disruption in the collagen and elastin. So that is one part. But there's also another part which mostly shows in the neck, which is the gravity, which is the laxity. Things fall down and they kind of loosen up. And that's partly because with age, we lose our fat pads and the skin becomes very thin and it lacks the tight, the tight, the collagen and the elastin that make it tight. So then if there's laxity, the next thing I would suggest, and also it depends on their age and it depends on the condition of their neck, I might recommend HIFU, high intensity focused ultrasound, as a combination with laser, because HIFU can lift and tighten. And here we're talking about non-surgical neck treatments. So that would be the second thing I would recommend. If there's loose and saggy skin, HIFU can help. It can be done, of course, full face, but a lot of the times in the clinic, we tailor the treatments to what the patients need. You don't have to do the face if you don't need the face or you don't want to improve the face. So it can be done on the jawline and the neck. Couple of sessions, 3 months apart, can boost the collagen and tighten and cause some lifting effect and tightening effect. So
can you do HIFU and laser with Botox as well?
You can, absolutely, not on the same day. It's on separate days. So that's why when a consultation is very important, because with the consultation, I can determine what the neck needs. And then we give them a tailored program specifically designed for them, which would also indicate when something can be done and how to space it from the next treatment.
I think it's important as well for the viewers to understand that the consultation is more or less like a medical evaluation for suitability as well. And in our experience, particularly in the aesthetics industry, there's a lot of, let's say, startup practitioners who don't really have any sort of like detailed medical background offering these types of treatments. And it can lead to problems. Some people may not be suitable for certain things. And I think it's just very important that viewers understand that, your medical background and that you are a consultant dermatologist and you have the knowledge to correctly evaluate patients when they come in and to determine if a particular treatment is going to get them not only the result that they're expecting, but also to do it in a safe way.
Yeah, 100%. Suitability is very important, especially when we're doing things like lasers, which I'm an expert in, and I utilize multiple lasers. We have multiple lasers in the practice. And an extra treatment that sometimes I recommend for the neck and which helps tremendously is laser, like fractional laser. And suitability is very important in that case because it might not be suitable for darker skin tones. I give them pre-treatment, post-treatment sometimes to prevent complications. I always do test patches to determine how the skin heals. Are there any complications? Is it suitable? The setting is suitable. So it is aesthetic, but at the same time, it's always medical. They can't just call and say, I'm going to do CO2 for my neck or my face. I have to see them and I have to assess they're suitable. I sometimes give them a pre-treatment to prevent pigmentation, post-treatment advice on proper sunscreen use, give very detailed post-care instructions to avoid infections, avoid complications. So absolutely, this is very important.
That's superb. So the different types of approaches to neck rejuvenation, we have Botox, which we've discussed, HIFU. Are there any other treatments that you can do to firm up the neck?
Absolutely. After relaxing the platysma, which kind of relaxes the muscles of the neck, and like I said, everything springs up, doing some HIFU if they need it, high intensity focused ultrasound to boost the collagen internally and tighten up. Then we're left with the skin itself, which could be thin and wrinkly, the surface of the skin itself. And there are loads of things I can offer to improve the texture of the skin itself. Starting with lasers, like I said, I do lots of lasers and I'm experienced in lasers. We could do the fractional resurfacing lasers, which basically I use for rejuvenation and I also use for scarring and tightening. Basically, what the lasers are doing, they're creating micro injuries in the skin. That's the concept, similar to micro needling, but the lasers are stronger and they produce better tightening because of the heat. And thereafter, the skin, as it's going to heal itself from those specific calculated microscopic injuries, there's a boost in collagen and elastin and tightening of the skin. And there are two lasers I typically can offer for the neck, depending on the, the skin type, the suitability for each treatment. So there's the non-ablative fractional laser, which leaves the surface of the skin intact and the laser beams go inside the skin. So with
Sounds
this,
painful.
numbing cream and cooling helps. Not massively painful, no. It's okay. It's typically it's very well tolerated. They don't
Okay.
need anesthesia. It's just a bit of numbing cream. And it feels like a sunburn right after, but that fades off within a few minutes, 20 minutes. And then there's the ablative laser, which actually the CO2 laser, which actually punctures tiny microscopic wounds in the skin. The non-ablative has minimal downtime, just a bit of redness, easy for people who are in the office every day or they're on the run or they don't have downtime, they don't have time for downtime. Whereas the CO2 laser typically is the ablative laser, which needs preparation before and after, and there's a bit of scabbing for a week. So these are the lasers, and they work wonders on rejuvenating the skin, whether for wrinkles or scarring. And in the neck, they tighten the surface of the skin and make it more tight and looks better. And then, so that is something I can recommend to add to the package, and I can gauge whether they're suitable for non-ablative or the ablative CO2 laser. And then I can also rejuvenate by microneedling. Microneedling is easier, downtime is minimal, cheaper as well, factoring cost into all of these treatments. And it can be combined with PRP or platelet-rich plasma, which a lot of people probably have heard about or know about.
Is that the same as the vampire facial?
Yes. Yes, it's exactly as a vampire facial, creating micro injuries in the skin with the microneedling, extracting the blood in special tubes, spinning the blood, which separates the red blood cells from the plasma, the serum component of the blood. And then we take that plasma, which is rich in growth factors, reapply it or inject it in the area, and the growth factors penetrate into the skin and they boost. And at the end of the day, all we're doing, using different approaches, is to boost that's the secret word and the star word, the collagen and the elastin. All of these things are pushing the skin to produce better collagen, better elastin, tighter skin, younger looking skin, healthy skin. And maybe it's worth mentioning here, which is unrelated. Lots of people think that if they drink collagen, their skin is tighter. And actually, that is not entirely true, because collagen itself is a big molecule and it is manufactured in the skin. Like it's, you can't actually drink it and bring it up to the skin. There are specific cells in the skin that are called fibroblasts. Those are the ones which are responsible for producing collagen, and it is produced in the skin. So what we can do is push these fibroblasts with creams, with procedures, with heat to produce better, newer collagen. If you swallow collagen, your stomach acids will break it down into individual tiny amino acids. So it's not collagen anymore. So you're actually absorbing the building blocks of collagen, but not the actual molecule.
So people are wasting tons of money trying to, buy these drinks and things like that.
Yeah, I mean, it has been mentioned in some studies that hydrolyzed collagen is better than the normal collagen. But yeah, it's basically made, the better collagen is made in the skin.
Super interesting. Wow, I had no idea. I think I have collagen drink downstairs. I'm generally serious, so I'll just probably stop taking that now.
Yeah.
So we have HIFU, we have laser, we have Botox, we have PRP, we have microneedling. What about dermal fillers? Because you see a lot of dermal fillers being promoted for neck tightening. Is that an additional effective approach?
Not specifically. The only time I might recommend dermal fillers, and I've done it, is when they have a thin neck, particularly more younger individuals with a tight and thin neck, but their lines, the horizontal lines, are very obvious and they kind of are depressed. So then I can inject fillers only in the neck, and these would be the lower concentrations of the hyaluronic acid fillers, and go along the line and deposit some fillers, and that helps as well. Bearing in mind that these necklines are movement lines, so every time they're bending their neck and they're moving their neck, they are still showing the lines. But sometimes it helps because they might have lines without movement, and adding a bit of filler in these lines can help. Another another indication for fillers in the neck is not particularly in the neck, but in the jawline. Jawline fillers can help define that area. They're not in the neck, they're just on the jawline along the bone, and these can help define the jawline, if you want to call it neck. It's part of the neck.
Very
It's kind of the middle way between the face and the neck.
It's very interesting because you see a lot of clinics and aesthetic practitioners promoting dermal fillers for neck rejuvenation.
If we want to talk about fillers, we could be talking about hyaluronic acid, which could be used as a skin booster in the neck, not fillers. So like Profilo or hyaluronic acid skin boosters, which is the non-cross-linked hyaluronic acid. So hyaluronic acid is, as a filler, is cross-linked. The molecules are manufactured in a way that they are kind of stuck together, and when injected it produces volume, it lifts, and it stays there for a year and a half, depending on where we're injecting it, 9 months. That's the cross-linked filler hyaluronic acid. But hyaluronic acid non-cross-linked can be injected in the neck as a booster, things like Profilo, for instance, which is a non-cross-linked hyaluronic acid, and it can be injected in the neck in certain areas. It kind of spreads in the dermis, which is the layer of the skin that has all the collagen and the elastin. It hydrates the skin, and it also again pushes for more collagen and elastin, and it kind of produces an improvement in the texture of the skin. So not as fillers, rather than as skin boosters. The fillers are only in very particular areas in the necklines and in the jawline, not the neck itself. The neck is super thin and you don't want volume in the neck. And another injectable treatment that can be used in the neck are the new polynucleotides, which are like the salmon DNA, which we are more and more using for rejuvenation as a single treatment or as an add-on. And those basically as well are can be injected in the neck and elsewhere. and they rejuvenate the skin basically by saying again and again, improving collagen. They prevent wrinkling, prevent sagging, and tighten the skin.
Very interesting. And so, have you ever had a patient for this where you've said, you know what, non-surgical might not be the best option?
Well, yeah, that's the assessment. That's why the assessment, if the aging is quite advanced, if the sagging is very severe, and if there's a lot of loose skin that I cannot tighten with non-surgical approaches, typically older patients who haven't done anything throughout the years, because doing anti-aging procedures is a treatment and it's also a prevention for aging. So if you start young and you keep doing, a few things in addition to using good skincare to prevent aging, like retinol, vitamin C, glycolic acid, all sunscreen all the time. So if they've reached like an advanced age, we're talking 60s and or later, and the neck is super loose and the skin is super loose, then I might say you probably better go to a plastic surgeon, have a neck lift, and then you can come back to me and I'll treat the surface of the skin with all the other things we talked about. But if it's early on, then I would recommend non-surgical. And like I said, I would just offer them what basically I would recommend for their specific neck. And then they can pick and choose whether they do all of them or some of them, or do some now and some later.
So a patient has come to you, they've had a neck rejuvenation treatment. How typically long do the results last? Because it is non-surgical. And what can patients do to maintain their results?
So from the treatments that I went through and I mentioned, the Botox injections, botulinum toxin, typically lasts between 4 to 6 months, similar to its effect on the face, after which the muscle becomes tight again and it has to be re-injected. So typically, to maintain the results for platysmal tightening, it has to be repeated 2 or 3 times a year. And the more we do it, the less likely the muscle is to go back to its original strength, and the longer it lasts. With fillers, if we're talking about fillers in the necklines, typically they would last also about 12 months, 9 to 12 months, and then they can be repeated. All the other treatments, because they are basically, as I mentioned, whether it's high intensity focused ultrasound, the HIFU, whether we're talking about the lasers, the microneedling, or all the skin boosters, what we're getting from these treatments is a tighter skin, a new collagen deposition, an improvement in the texture of the skin. And I don't want to say permanent because that sounds as if it's a surgical procedure, but it is in a way your skin. So the newer skin and the new improvements in the skin are kind of there to stay. Of course, there's the factor of aging that is working against us, but if they are maintained with like once a year treatments, let's say HIFU is typically done once and then repeated 3 months later, and then probably once a year. Skin boosters, for example, the polynucleotides, they're done as a series of 3 sessions, 3 weeks apart, and then they can be repeated again every 4 to 6 months. So typically 2 to 3 treatments a year afterwards would help maintain and boost further. And especially if they are using the creams that I would recommend, which are, like I said, a combination of retinol, some glycolic acid, vitamin C. Those will help maintain the improved skin texture. But I would say probably the one that mostly needs regular repetition would be the botulinum toxin. Um, Typically, the one that leaves the most downtime is the, if I recommend it and if patients can do it and if they can afford downtime, would be the CO2, the ablative fractional laser, because like I said, that is ablative, so there is a bit of scabbing in the skin that typically lasts up to 10 days. And afterwards, the skin might be a bit sensitive and red for a while. Uh, all the other procedures are minimal downtime to no downtime. So HIFU has no downtime. And the non-ablative fractional laser has minimal downtime, a bit of redness. Microneedling as well, couple of days where the skin is a bit red. With the injectables, there's no downtime except for an occasional bruise that can be, covered with makeup, but there's no downtime. As far as pain is concerned, we're very cautious here about making sure patients feel minimal pain. It's not, um,
because the neck is quite a sensitive area.
So,
And
yeah. So I typically apply numbing cream and leave it for enough time, whether I'm doing injectables. Some patients tell me, I don't care, I have a very high pain tolerance, don't do it. But we typically offer it to everyone. So for lasers, for injectables, there's always numbing cream, for microneedling as well. The only treatment that we do without numbing is the HIFU, because this is the recommendation, because there's no signs on the skin on how deep the heat is going. The patient's reaction, or not their reaction, their feedback to how hot it is important, but it's very well tolerated. It just feels like pulses of heat or tingling. Most people tolerate it. And I also have a cooling device in the skin, which is called the Zimmer cooler, which emits cold air, really cold air. It's not a fan, it's cold air. And we when doing lasers, that can help cool the skin down, and it also helps with pain. So they're very well tolerated, and we kind of hold their hands and give them even a squeezy ball all the time, and use the thinnest needles possible. So it's very well tolerated.
since we have you here, Dr. Hiba, what is some general advice you would give, because you are a consultant dermatologist? I mean, you guys are in Harley Street. You're in the best place in the world for skin treatments. What lifestyle or skincare advice can you give me or anyone really to maintain healthy, rejuvenated skin, particularly around the neck?
So if you ask any dermatologist what is their one advice to prevent aging, and now we're talking about preventing aging, it would be the sunscreen. Wear it every day, apply it, whether it's sunny or not sunny or rainy, from a young age onwards, because sun is a major factor in aging. But because we're talking specifically about the neck, where sun is involved in aging, but there's also the laxity and the thinning of the skin. I would say to prevent aging, to help prevent aging before you reach the stage of doing procedures with me in the clinic, is use some creams that are preventative. So mostly, like I said, a high, good concentration of vitamin C, at least 10% every morning, under your sunscreen. Wear an SPF of 50, 30 to 50 at least, and put it generously. And use something like retinol at night, which would help boost the collagen and tighten the skin.
Dr. Hiba is a fountain of knowledge when it comes to skin and rejuvenation and anti-aging. And so if you are in central London and you have any concerns related to your skin, whether it be medical or aesthetic, do come and visit Dr. Hiba and her team at Dermasurge in Harley Street. they will make sure that you are really well taken care of. They also do online consultations and in-clinic consultations. You don't necessarily need to be in central London to actually get your skin condition looked at by Dr. Hiba. The clinic also do next day appointments. So if you have something that's more urgent, they can facilitate a consultation quite quickly and help you get whatever issue it is resolved.
Thank you, Freddie. I've enjoyed this conversation. Thank you for the
Me as well.
nice questions.
Me as well. Thank you so much.
Thank you. Bye.